Today, we're going to decode one of the most common, but also one of the most powerful lab tests your doctor will ever order, the complete blood count, or CBC for short. It's like a fundamental snapshot of your health, and over the next few minutes, we are going to break down exactly what it all means, nice and simple. Sounds a little dramatic, right? But honestly, it's true. A single CBC can be like a detective, uncovering clues about everything from hidden infections and anemia to potential bleeding disorders. It really tells the story of what's happening inside your body, right now. So, at its heart, what even is a CBC? Well, you can think of it like a roll call for the three major teams of cells that are floating around in your bloodstream. The test basically counts who showed up, how many of them there are, and it even checks in on their general size and shape. To make this super easy to follow, we're going to break this down into 4 parts. We'll meet the 3 essential crews. We've got the oxygen crew, the defense team, and the clotting crew. And then, at the end, we'll pull it all together with a simple framework so you can make sense of it all. First up, the red blood cells. Now, these guys are the tireless workers doing one of the most critical jobs in your entire body. They transport oxygen from your lungs to every single tissue that needs it to survive. They're your own personal delivery service. So when you're looking at red blood cells, 2 numbers are going to jump out at you right away: hemoglobin and hematocrit. Hemoglobin is the actual protein that grabs onto the oxygen. And hematocrit, well, that just tells us what percentage of your blood's total volume is made up of these red cells. You can think of it like this. Hemoglobin is about the function and hematocrit is about the space they take up. That's why you always look at them as a pair. And hey, here's a fantastic little memory trick to quickly check if things are in balance. It's called the 3-to-1 rule. Your hematocrit number should be roughly 3 times your hemoglobin number. So, for example, if your hemoglobin is 12, you'd expect your hematocrit to be right around 36. If that ratio is way off, it's a big clue that something's up. Maybe the cells themselves are an abnormal size, or maybe it's something as simple as a hydration issue. You see, it's the relationship between these two that really tells the story. If both numbers are low, that could point towards something like anemia or maybe some bleeding. But what if your hemoglobin is normal while your hematocrit is low? Well, that might just mean your blood is a little diluted, maybe from overhydration. And the opposite? A normal hemoglobin with a high hematocrit can be a classic sign of dehydration. It's all about context. Okay, so let's say your hemoglobin is low, which suggests anemia. The very next question is, what kind of anemia is it? That's where MCV comes in. It stands for mean corpuscular volume. Now, corpuscular is just a fancy word for cell. So all this value is telling us is the average size of your red blood cells. Are they too big, too small, or are they just right? And this basically points us down 2 main paths. If the cells are too small, that's called microcytic, it's often a big clue that there's an iron deficiency. But if the cells are too large, macrocytic, that might suggest a deficiency in vitamins like B12 or folate. See how that works? The MCV acts like a little detective, helping narrow down the cause. All right, let's move on to our second crew and see how this all builds. The white blood cells. This is your body's immune system on patrol. Think of them as your internal security detail, and they are constantly on the lookout for infections and other threats. The total white blood cell count gives us that bird's eye view of your immune activity. A high count, which has the fancy name leukocytosis, is the classic sign your body is fighting off an infection. On the other hand, a low count, or leukopenia, can be a bit more concerning. It often indicates that the immune system is suppressed, maybe by a medication or some underlying condition. But, that total count is really only half the story. The WBC differential breaks that big number down into 5 distinct types of white blood cells. And you'll notice right away they aren't all present in equal amounts. Neutrophils are the dominant force here. They make up the vast majority of your immune army. Each of these cell types has a very specialized job, kind of like different units in the military. A really simple way to remember them from most common to least common is the phrase, "never let monkeys eat bananas." That stands for neutrophils, lymphocytes, monocytes, eosinophils, and basophils. See? So neutrophils are like the infantry against bacteria. Lymphocytes are like special ops for viruses. And eosinophils, they handle things like allergies and parasites. Knowing which one is elevated gives doctors a huge clue about what exactly they're up against. And that brings us to our third and final team, the platelets. These tiny little cell fragments are your body's emergency repair crew. They rush to the scene of any injury to plug leaks and stop you from bleeding. Pretty important. And there are a ton of them. I mean, a normal count ranges from 150,000 all the way up to 300,000 in a single tiny microliter of blood. Your body keeps a huge supply ready to spring into action at a moment's notice. Now, this is a really, really crucial point. The CBC tells you how many platelets you have, but it doesn't tell you how well they're actually working. A person can have a perfectly normal number of platelets, but if those platelets aren't functioning properly, they can still have big problems with bleeding or clotting. That requires a different, more specialized kind of test. So what do the numbers mean? Well, a low platelet count, or thrombocytopenia, means you have a higher risk of bleeding because there just isn't enough of a crew to patch up injuries. On the flip side, a high count, or thrombocytosis, can increase your risk of forming unnecessary clots inside your blood vessels, which is also dangerous.
Whew! Okay, we've covered a lot of ground. We've met the three main crews and their key stats. So how do you take all this information and actually make sense of it quickly? Let's put it all together into a simple three-step approach.
Here it is, your CBC quick check. It's this easy. Step 1, check the RBCs, your oxygen crew. Are hemoglobin and hematocrit in range and in balance? Step 2, check the WBCs, your defense team. Is the total count off? And if so, which specific cell type is causing it? And step 3, check the platelets, your clotting crew. Is their count where it needs to be? It's that simple. 1, 2, 3.
So, the next time you see a CBC report, you won't just see a list of numbers. You'll see clues about your body's most essential teams and how they're doing. Because the real skill isn't just about reading the numbers. It's about asking, when you put it all together, what story are these cells trying to tell you?